of birth. We are recording. Things like anoxia, lack of oxygen to the fetus, that can damage the brain, especially a part called the hippocampus. So we measured the biological risk factor at birth, and then we also had social workers go around all the homes of the mothers when the baby was aged 1 year. And the interviewers assessed maternal rejection of the child. What does that mean? Well, it was a mum who didn't want the pregnancy. She made an attempt to abort the fetus. She failed. These are live male births. And thirdly, the child would be institutionalized for at least 3 months in the first year of life, breaking the bond between the mother and the infant. We then followed them up for 18 years to find out which ones had committed a violent criminal act. And this is what we found. On the y-axis, we have the percent of violent crime at age 18. The controls don't have birth complications. They don't have maternal rejection. The social group only have the maternal rejection. The biological group only had the birth complications. The last group, the biosocial risk group, had both the combination of birth complications and a neglectful mum. These three groups do not differ significantly. The effect is in this group. Here we get a threefold increase in the rates of violent crime 18 years later. So the important heuristic message here is that it's not just biology. It's not just the social environment. But put the two together, you can get a significant increase in violence 18 years later. And indeed, we followed these people up to age 34. We still get the same effects. Do the findings replicate? Because we have a replication crisis, don't we, in psychology? The answer for this interaction is yes, they do. Picaro and Tibbetts in Philadelphia, a different country and a different ethnic group, all African Americans, looked at the same type of study. They had the same study design. And as you can see here, they get pretty well the same findings. And these findings replicate in other countries like Canada and Sweden. So the findings replicate. So even at birth, there are risks for future violence beyond the individual's control. What else? Anyone recognize this country? Any guess, anyone? Netherlands, that's right, the tulips from Amsterdam, the windmills, Netherlands. It's an amazing study from the Netherlands. It's the Dutch famine study. So the setting here is it's the end of World War II. Germany is pulling out of the Netherlands and there's a food blockade on the island. Oh, sorry, the country. Some mums were pregnant during that time. And a researcher from Columbia University, Richard Neugebauer, compared mums who had poor nutrition during pregnancy, and he compared them to mothers who did not have poor nutrition during pregnancy. And the outcome is looking at the offspring to see which ones develop what's called antisocial personality disorder. You can see at that time here that the children were pretty skinny with the poor nutrition. What Neugebauer found here is that the mothers who had poor nutrition during pregnancy, their offspring were 2.5 times more likely to grow up to become what's called antisocial personality disordered. That's a psychiatric term meaning lifelong criminal offending. So that's another factor, poor nutrition during pregnancy. That can raise the odds of future violence in the child. What else? Well, smoking during pregnancy is another factor. This is data from my past PhD student, Patricia Brennan. On the y-axis, we have rates of violence at age 34. And during the prenatal period, she measured the number of cigarettes that the mother smoked during pregnancy. 0, Mum didn't smoke at all. Mother smokes 1 or 2 cigarettes a day, all the way to smoking more than a pack of cigarettes a day. And what you can see here clearly is a dose-response relationship. The more cigarettes the mother smokes, the greater the rates of violence. And that's controlling for social background factors, because mums who smoke during pregnancy are different to mums who don't smoke cigarettes during pregnancy. And certainly more than 20 other studies have found this relationship. It replicates really very well. So what else? What else really early on in life will push up the rates of violence in the little baby? Well, drinking during pregnancy is another factor. We know that mothers who drink quite a lot during pregnancy give rise to fetal alcohol syndrome. This is the baby here with fetal alcohol syndrome. Its mother drank during pregnancy. It has craniofacial abnormalities, lack of development of the nasal bridge, epicanthal folds, eyes wider apart, low-seated ears. The philtrum here is underdeveloped. I want to highlight the research of Streisguth, because she had a sample of 473 of these babies, following them up over time, a longitudinal study into the teenage years. And here you can see the rates of delinquency, police contacts, and arrests in these babies when they grow up. Now, why is that? Well, clearly social factors are important, aren't they? But we also know that alcohol is toxic to the brain. So this is the brain of a baby that died at 6 weeks of age for reasons other than fetal alcohol syndrome. And this is the brain of a baby that also died at 6 weeks of age, this time due to fetal alcohol syndrome. And we can see here the ravages that alcohol does to the developing fetal brain. And to me, that raises a question. I want you to take a close look at this baby, and we can ask ourselves a number of questions. Was that baby exposed to alcohol during pregnancy? Yes, it was. You can see it in its face. Is that baby more likely to grow up to become a criminal offender? Yes, it is. You've seen the data from Streisguth. Was that baby responsible for the fact that its mother took alcohol during pregnancy? You're shaking your head. No, it's not. Will we hold this baby responsible for its crimes? Of course we will. So my question to you is that justice? Is that your idea of justice? Because it's not mine. But the problem with my conclusion is, if we do not hold this baby responsible for its crimes, who are we going to blame? We always need somebody to blame and somebody to hold responsible. Well, some people believe we should hold the mother responsible. Here's Jamila Falls. She's a mother, Memphis, Tennessee, and she gave birth to a lovely little girl. The only problem is that on its birthday, the baby tested positive for heroin and marijuana use. Jamila had been abusing drugs. So in Tennessee law, that is an assault of the mother on the fetus. That's the legal term that's used. And she's convicted of assault and goes to prison for that offense. So I think the question we've got to ask ourselves here is, does she need handcuffs or does she need help? Do we want more laws like this to enhance greater parental responsibility to protect the future generation of children who can suffer from bad parenting? Or does Jamila Falls need help and not handcuffs? That's a question, I think, for us all to think. I can't dictate an answer to you, but I'm sure you'll come to your own opinion and judgment. Okay, so I've discussed some early biological risk factors that raise the odds that somebody will become violent. What I want to do now is turn to brain mechanisms, which I think link those early health risk factors to later behavior. The first thing is the brain, of course. I mean, prefrontal functioning. This is a study I did nearly 30 years ago. It was the first brain imaging study of murderers. And indeed, that's one of the reasons I left England to go and work in Los Angeles, because there's so many more murderers in Los Angeles you can round up and put into a brain scanner. There's much fewer in London. So what I was able to do is get 41 murderers, put them all together, put them in the brain scanner using the same protocol. And I compared them with 42 normal individuals. You're looking down on the brain. The warm colors, red and yellow, indicate high glucose metabolism, meaning good brain functioning. Cool colors, the blue, the green, indicate low brain functioning. The key finding from the study is that murderers as a group have poor functioning in the prefrontal cortex, the very front part of the brain. Why is that? Well, we know that the prefrontal cortex is involved in regulating our emotions. It's involved in inhibiting our impulsive behavior. I mean, let's face it, we all get angry at times, don't we? What stops us lashing out? We've got a good prefrontal cortex that checks on that impulsive behavior. You can think of it as the guardian angel on behavior. But if the guardian angel is asleep, as it is in some murderers, well then, the devil can come out. People can get killed. I have to say that not all murderers are the same. So this is one of my murderers who killed 64 people in a 12-year period, almost not getting caught. Indeed, Randy was very unlucky to be caught. He was driving late at night south of Los Angeles, and of all the things he did, he made an illegal lane change on the freeway. Any of us ever made an illegal lane change? It was his unlucky night because the California Highway Patrol were right there. So they pulled Randy up and stopped him, and they only became suspicious when they found a dead body in the passenger seat. Bit of a giveaway. But if it hadn't been for that, Randy could still be out killing right now. Let's look at his brain scan, and it's the one in the middle here. And you can see Randy has pretty good frontal lobe functioning. What do we make of that? I take it as the exception that proves the rule. Because here we have a man who could carefully plan, regulate, and control his behavior for 12 years, killing 64 people. You've got to have something good going for you to be able to do that. And what Randy had good going for him is a good prefrontal cortex, allowing him to plan, regulate, control. He would take men out, he would pick men up, pick them up at the bar. He would try and get them drunk. If that failed, he'd put drugs into their drink. Then he'd have sex with them. Then he'd kill them. He'd clean up the mess to get into work the next day as a computer consultant. So, I mean, the point I want to make here is that not all murderers clearly are the same. And the poor frontal lobe functioning may especially apply to impulsive murderers, not planned, regulated murderers. There was an individual with another brain scan. If you look at this brain scan, do a bit of pattern recognition here. So look at the pattern in that brain, and I want you to compare it with these three piles. Which pile does it best come under? The normal, the multiple murderer, or the one-off single murderer? It's not a perfect match by any means. Anyone have any guess? Or which pile would you sort it under? Yeah, the multiple. Again, it's not a perfect fit. Most people would put it in that pile. What's interesting about that brain scan is that it's my brain scan. And the point to make from that is that brain imaging is not diagnostic. We cannot use brain imaging to say who's normal, who's a one-off killer, who's a serial killer. No, we can't do that. But nevertheless, imaging is giving us clues about what brain area, when dysfunctional, can predispose to future violence. Another important brain area that I want to discuss is the amygdala. It's the seat of emotion in the brain. And you'll have heard of psychopaths. If you've never heard of psychopaths, these are criminal offenders who lack remorse, they lack guilt, they lack shame. They don't experience emotions in the way that we do. We were interested in looking at the amygdala in psychopaths because it could give us some clues to their behavior. We brain scan psychopaths. This is structural brain imaging. And what we find in the group of psychopaths compared to the matched control group is that they have an 18% volume reduction in the amygdala. It's literally shrunken in size quite significantly. And that might help explain why psychopaths conduct such heartless crimes and why they don't have any feelings about the terrible things that they do to people. They don't have a conscience. They don't really experience remorse in the way that we do. We also know that the amygdala is functioning more poorly in psychopaths. So we brain scanned psychopaths using functional imaging when they were doing moral dilemmas, when they were making moral decisions. So here's an example of a task that we would give them, and it's the footbridge dilemma. So you're standing on a footbridge, and there's a runaway trolley going to kill 5 railway workers. Standing next to you on the footbridge is a large gentleman. The only way that you can save these 5 people is you push the big guy off the bridge. He dies, but he stops the train and you save 5 lives. I want you all to think right now what you would do. Would you push the big man off the bridge? Just think about it. Don't say anything. Just think about it. Come on, push him off. Do the numbers. It's 5 to 1. It's utilitarian moral decision making. The guy's overweight anyway. He'll likely die early of heart disease. So give his life some meaning. Push him off the bridge, and at least he can die happy, saving 5 lives. But thou shalt not kill. Hence the dilemma. I'm less interested in what you say you would do, and I'm more interested in how you feel when you were thinking about what you would do on that footbridge. Because for many of us, going through these moral, personal dilemmas, we feel slightly uncomfortable about the whole situation. And that's because our emotional amygdala is firing. But what we find is that when we brain scan psychopaths, this is degree of psychopathy, low, high. This is degree of amygdala functioning, low, high. Every red dot is a person. What we find is a significant correlation between psychopathy and amygdala functioning. The higher the psychopathy score, the lower the amygdala functioning. So again, that could give us a clue about why psychopathic criminal offenders are so very immoral. They completely lack a moral sense. And that was a belief that psychiatrists had about psychopaths more than 100 years ago. But in addition to the scientific knowledge, to me, it raises a moral question for all of us. Because the Hannibal Lecters of this world, they know right from wrong. They know it's wrong to kill. Hannibal knows it's wrong to eat somebody's kidney with fava beans and a nice Chianti. But does he have the feeling of what's right and wrong. Because I would argue that the emotional amygdala is the engine which in part gives rise to moral behavior. And if that engine is burnt out in psychopaths, then, you know, should we punish them as harshly as we do? Because psychopaths don't ask to be born with an amygdala that's, you know, 3 sizes too small. What I want to do now is I want to continue with that theme, but I want to turn to a couple of other societal issues here. First of all, there's now hundreds of studies on criminal, violent, and even murderous offenders. And the question is, how are we going to use that evidence, that knowledge? Well, first of all, prevention. How do we prevent bad brain leading to bad behavior? Because if you take the assumption that I've talked about, a negative brain functioning is related to crime and violence. So what are we going to do about that? How can we improve the brain to improve behavior? I want to show you data here from Joe Hibbeln. What he did, he plotted homicide rates in 26 countries throughout the world as a function of seafood consumption. So for example, and he finds a relationship, he finds a significant correlation. So for example, let's take Japan. They eat more than their whole body weight in fish every year. Low homicide rates. In contrast, Eastern European countries tend to have higher homicide rates, and they have lower fish consumption. Hibbeln did not put Serbia on this graph, and I'm curious to see where would Serbia fit? I know at this point in time, your homicide rates were around 2.7, but I don't know where your fish consumption was. Somebody will have to find that out. But the point is, there is this link. Eating more fish cannot protect us from crime and violence. It sounds a fishy story, doesn't it? You know, more fish, less crime. And it's only a correlation. And as we all know in psychology, correlation is not causation. The only way we can ever demonstrate causality is through randomized controlled trials. So that's what I've been doing for the past 6 or 7 years. I've been trying to take this hypothesis, and I've been conducting randomized controlled trials largely on children and adolescents, giving them omega-3, the stuff that's in fish. You're nodding your head, you know this. The long-chain fatty acid. It's critical for brain structure and brain function. It regulates gene expression. It enhances dendritic branching in the cell. It makes up 35% of the cell membrane. It's absolutely crucial. So I've been finding in studies on children giving them omega-3 that it does reduce their impulsive aggressive behavior. But what about prisoners? So I have my last study published relatively recently was conducted on young offenders, 145 young offenders. Every day I gave them a fruit juice drink. It's 200 milliliters. It's about 2/3 the size of a standard Coca-Cola tin. But it's packed with a whole gram of omega-3. They take the drink every day for 3 months. And this is the results here. On the y-axis, we have impulsive aggressive behavior. 0 months is the baseline. They take the drink for 3 months, then the treatment ends. And then we follow them up after the treatment at 6 months and 12 months. And what we find is that there's a sustained reduction in impulsive aggressive behavior in the prisoners. So my message here is that it works with children, works with adolescents, but it also works with young offenders. There's only 3 studies in the world that have ever done a randomized controlled trial in prisoners. They all find significant effects. So could that be a way to upregulate the brain, to upregulate behavior and reduce crime and violence? I think you'd all be happy with me giving prisoners, better nutrition. But would you be happy with me going into the Holy of Holies, going into your brain, manipulating your brain to reduce criminal behavior? Well, that's what we've been trying to do using a technique called transcranial direct current stimulation. So this is data published by my graduate student. So what's happening here, it's a double-blind randomized controlled trial. And what we're doing is stimulating the prefrontal cortex, that part of the brain that many studies now have shown to be dysfunctional in offenders. So half the group get the brain stimulation, the other half have the electrodes on, but they are not getting the stimulation. They think they are, they're just not getting it. The next day, my graduate student brings the subjects back into the laboratory and conducts a social vignette on them to measure their intention to commit a violent act. What's that? Well, here's an example. You're told you're in a bar with your girlfriend. You go to the restroom and you come back and you see some other guy hitting on your girlfriend. And worse still, she seems to be enjoying herself. So you go up to him and say, hey, that's my girlfriend. But he says, she's not wearing a ring. She can speak to anyone she wants. The question, push comes to shove, the altercation gets worse and worse. The question is, would you pick up a beer bottle and whack the blighter on the head with it? And what we find is that those who get the stimulation, the green bars, they show a significant reduction in their intention to commit a violent criminal act. And we get significant effects also for sexual assault too. Now, that's just an initial study. It needs replication. It needs extension to real life behavior, not just the laboratory. But could that, in theory, be another way of changing the brain? If it was, supposing it did work, would you be happy with people doing this? Not just to prisoners, but people in the community who show a significant risk for being violent and aggressive in the future. And moving on to what I've just been alluding to, prediction. Would we use brain imaging to identify who amongst us is at risk for being a violent criminal offender? I'll just give one example. This is a study I did with my colleague Dustin Pardini, and we brain scanned young offenders in the community. We measured amygdala volume, because remember, we think low amygdala volume is a risk factor for violent crime. We then followed them up for 3 years after we'd done the brain scan. So, excuse me. So the blue bars are those with low amygdala volume, and that dark red group are those with high amygdala volume. These are the rates of violent crime 3 years after the brain scan. What you see is that those with smaller amygdala volumes do have higher rates of violence 3 years later. In fact, it's threefold higher. And that's prediction controlling for prior history of aggression, prior history of violence, prior history of psychopathy. So again, could we use biological data, combine it with social data, together with machine learning, random forest techniques, advanced statistical techniques in the future to predict who amongst us is at risk for becoming violent? And then the question is, what do we do with that information? What you see there is Minority Report. That's, you're nodding your head, that's the Tom Cruise movie that you've seen. And that movie was all about the preemptive strike, stopping violence even before it starts by identifying those amongst us with all the risk factors for future violence and institutionalizing those people because they're dangerous. Would we ever do that in the future? What if in the future we get a level of prediction that some people, maybe the government, says now is the time to act? Lastly, I want to turn to the issue of our concepts of punishment and responsibility. I'll give you a case study here. This is Michael. Michael is a school teacher. He used to be a correctional officer, but he got his master's degree and became a school teacher. He's happily married to his wife, and he's got a 12-year-old stepdaughter. But things began to change. What I'm going to do is show you a 3-minute video clip where you'll hear from Michael, you'll hear from his wife, you'll hear from his stepdaughter about the change that began to take place. And then after that 3 minutes, I'll continue the story to tell you where that leads to.
I didn't see anymore, I didn't hear anymore, I had no suspicions of any until February 14, which is Valentine's Day of 2000. And I went to put a card, a Valentine's Day card, in his, the carrier that he took to work with him every day. And in there I saw that there was pornography. And I was horrified and so scared because you can't take porn to school. You just can't do that. You risk everything.
Michael was starting to act out of character in other, more frightening ways.
It seemed as though he was just always on edge, always angry. You know, he was taking pills every day because he was having these massive headaches. And we can remember this horrible argument we had on Thanksgiving Day where he grabbed my hair and actually pulled out, you know, some of my hair. And it was at that point I called a counselor and said, you know, we need some help.
In the months which followed, the stepfather, husband, and high school teacher began to lead a double life.
A ball rolling downhill. It just gained speed. Pornography and strip clubs accelerated and expanded to massage parlors. But all of this is a desire towards grown women.
And then in May, I found a magazine called Barely Legal, which showed young girls who supposedly are legal, but frankly look like they're 13, 14 years old. And I was absolutely furious. I took Christina, she and I went to my mother's to stay with her for a couple of weeks while I thought about what to do. Just sort of like this kind of look of, what?
Anne's daughter Christina was 12 years old when she too started to notice changes in Michael's behavior.
Like I've always been really, really close to my parents. They could lay down with me at night before I would go to sleep and maybe like sing me a lullaby or something like that. And it went on until I was way old. I remember like he would lay down with me and then that's when I started. It would always happen at night.
My wife started a nighttime class 2 days a week. She didn't get home until 10 o'clock at night. But when my stepdaughter laid down with me in her pajamas, I began to, not always, but sometimes, be a little more intimate with her than I should. And somewhere deep, deep, deep in the back of my head, there was a little voice saying, you shouldn't do this. But there was a much larger voice saying, what the heck, why not?
So Michael was found guilty of child molestation. And he was given the option, either you go into treatment or you go to prison. Michael, of course, chose the treatment. But in the treatment program, he began to make sexual approaches to the female staff there. So they threw him out and he had to go to prison. The night before he was due to go to prison, he developed a really terrible headache. Although so would you if you were going to prison for pedophilia. You're the lowest of the low in prison. So he went to the emergency hospital complaining of the headache. And also what he said was they were going to say, well, we can't treat you. But then he said, I'm worried that if I go back to my landlady who I'm staying with, I'm worried I'll rape her. So they couldn't let him go, and they admitted him onto the psychiatric ward under the diagnosis of pedophilia. So he's on the ward there, but again, he's making sexual advances to the female nurses. And on one occasion, he wet his trousers. And interestingly, he showed no emotion at all, no embarrassment, no shame, no awkwardness in wetting himself. So an astute neurologist had him brain scanned, and this is what they found. They found a tumor growing from the base of the prefrontal cortex, compressing the guardian angel on behavior. They resected the tumor, they took it out, and it was like Jekyll and Hyde. It was like a complete reversal of fortune. It was going from night to day. Michael's inappropriate sexual feelings all disappeared. The sense of remorse and guilt came back, and he went back into the treatment program. He didn't go to prison, went back into the treatment program. This time he successfully completed it, and he went back to live with his wife and his stepdaughter. And, you know, it should have been a happily ever after story, but after 6 months, the headaches came back, and his wife found child pornography on his computer. This time she divorced him because she couldn't risk Christina living with him anymore. But they brain scanned Michael, and they found that the tumor had grown back. So they resected this tumor for the second time. And for at least 6 years since then, Michael has been completely normal. It's like a pendulum swinging from normality to brain tumor to pedophilia to resection of the brain tumor, and for the pendulum to swing all the way back again, and for the pendulum to swing back and forth yet again. To me, it raises a sort of interesting question. The question of, was Michael responsible for his behavior? You didn't know this before you came in today, but you're on the jury and you are going to make a decision. Now, don't worry, there's no right or wrong answer, but I do want a show of hands. You're going to make a snap decision. Okay? Take a deep breath. Please put up your hand if you would find Michael responsible. Thank you very, a few more, okay, about 4 people, thank you, hands down, thank you very much. So about 4 people would find Michael responsible. Take a deep breath again, hands up if you would not find Michael responsible. It's about 8 and the floating voter in the front here. So it comes down to 2/3 of you. Yeah, it's a difficult decision. 2/3 of you would not find Michael responsible because, of course, he's not responsible for the brain tumor, which led to the disinhibited behavior and inappropriate sexual feelings that resulted in the pedophilia. At least in American law, so now what you want to know the correct answer, don't you? Which isn't correct, but it's the legal answer. The legal answer in the United States, I don't know Serbian law, I think it's going to be similar, is that Michael is responsible. He has what we call rational capacity. What's rational capacity? It's made up of 2 things legally. Do you know what you were doing at the time? And you know that what you were doing was wrong. Can anyone remember what Michael said at the very end of the video? Yeah? You're exactly right. Absolutely. Thank you very much indeed. Yes, he said, deep in the back of my head, there was this little voice saying, you shouldn't do it. But there was a much bigger voice saying, what the heck, why not? Yeah, so Michael knew what he was doing. He knew what he was doing was wrong. And even Michael says, look, you know, I did it, blame me. I'm the one to blame. But is it just to blame Michael for that? 2/3 of us here would not blame Michael for that. And actually, I would also go along with the majority here. I wouldn't blame Michael. Michael even says, now, should I be held as accountable for this as somebody who did the same thing but didn't have the tumor? I don't think so. And I agree with Michael here. I don't think he should have been held as accountable. I think to me what this raises is when somebody has all the boxes checked, the social, the psychological, the biological, the risks for violence are there early in life, as I've tried to document, beyond the individual's control. Should we really hold them as accountable as we do? And indeed, should we hold emotion alongside cognition as a criteria in legal responsibility? Because legally, responsibility is defined as, do you know what you're doing? But I would argue that emotion importantly informs decision-making, and we can't really ignore emotional capacity, as I've tried to argue with that data on the amygdala. Well, we've come to the end, and just to sum up, early biological risk factors. I believe these early factors place constraints on freedom of will. Freedom of will is not as free as we would all like to believe. And for some individuals, there are significantly constraints on their freedom of will. Brain mechanisms, there are many, but I've only got time to talk about 2 that are quite well replicated. Poor functioning in the prefrontal cortex and structural and functional abnormalities to the emotion part of the brain, the amygdala. In terms of legal and societal and ethical issues, from a practical point of view, can any form of brain stimulation, whether it's omega-3, transcranial direct current stimulation, or even mindfulness training, which is known to upregulate the prefrontal cortex, should we be trying to use these more in these offenders and even people at risk for future crime? What about putting the biological data together with the social data to better predict who amongst us is prone to violence? And then when we get that knowledge, what do we really do about that? Those are a couple of the thorny issues that I believe are going to face us, not today, but in the not too distant future. And lastly, the case of Michael. As Portia said in The Merchant of Venice, should mercy season justice? Should our greater understanding and knowledge of the factors sometimes beyond the individual's control that leads to crime and violence render us more to the deeds of mercy?